Was a study done in England across their healthcare system, looking at over 111,000 procedures over those 20 years, so 111,000 ACL procedures, and they tracked them then for 15 years after their ACL injury and marked if they had a total knee replacement or not. Okay? And then they went and compared this to a group in 2016, 1-year period, of patients who had a total knee replacement who didn't have a history of ACL reconstruction, and looked at the risk across that. You can see overall, when you look at that top part of that data, the absolute risk for a total knee replacement within 15 years of ACL injury is really fairly low, right? 2% of patients are probably going to have a total knee replacement within 2 years, or excuse me, within 15 years, okay? So keep that in mind, because these relative risk numbers kind of blow you out of the water, right? If you're in your 30s, you're 20 times more likely to have a total knee replacement than another 30-year-old who didn't have an ACL injury, right? How many 30-year-olds do we know that have a knee replacement because of idiopathic reasons? Not very many, okay? So those relative risk numbers are extremely high, but the absolute numbers are still fairly low. So we're still really talking about it for these patients, but that still tells you something's happening really fast, very early, that are causing huge issues with some of these patients. We see that age increases your risk for total knee incapacity of ACL injury. This is probably pretty intuitive, right? If you have an ACL injury and you're older, you're probably at a higher risk of having a knee replacement in those 15 years. We know there's age-related changes in the joint, and that's going to predispose you to see those changes faster after an ACL injury. Also in this study, they found that women were 2.4 times more likely to have a knee replacement compared to men. That really matches what we know about idiopathic or primary OA, right? Women are higher risk for having OA, and this data seems to suggest the same might be true after ACL injury. So why do we care? Why do we care about post-traumatic OA development in these patients? A lot of these people, again, are very young. A lot of people want active lifestyles. And so this has huge implications on their quality of life at a very young age. Here's some additional data that might help you answer the question of why do we care about this after ACL injury. So we know that OA is associated with increased disability and activity limitation. About a quarter of people with OA are unable to complete all of their ADLs. We know OA predisposes you for a higher risk of other systemic diseases, cardiovascular disease, diabetes, hypertension. If you have symptomatic OA, you're 23% more likely to die early. So again, that probably is linked into some of those relationships with other systemic diseases and limited functioning ability. It leads to work limitations and absences. This is a huge problem because we're talking about young people, right? We're talking about people in their most productive years in terms of society and raising a family. And so that can have a huge impact on their work life and their home life. And it's going to cost the healthcare system more money. There's no cure for osteoarthritis, right? Right now we have no interventions that can reverse the process, and that's what makes this even more important when thinking about these other consequences after the development of OA. Finally, this was one really nice study that looked at the psychosocial impact of having OA at a young age. They looked at people who had diagnosed knee or hip OA, and they compared them to age and sex-matched controls. They looked at 3 different primary measures, so they looked at a quality of life measure. The people with knee OA had 32% lower quality of life, and the greatest differences were in women and in the age bracket of 40 to 49. So again, maybe that points to being at kind of that peak level in your work life, and also female responsibilities in terms of family life. They looked at a psychological distress scale. You see that the patients with OA were 4 times more likely to have high or very high psychological distress compared to the general population. And keep in mind, these are all patients between 20 and 55 years old. So when we talk about young people with OA, that's kind of the age group that we're talking about. The median age for OA development in the general population is about 55. Okay, so when we talk about less than 55, we're thinking about one of these early OA type of patients. And then workplace limitations, 44% consider themselves to have considerable workplace difficulty, 23% with moderate work disability. In this study, 16% of people had stopped working because of their OA, and about a quarter of people didn't do any unpaid work, community service, home activities because of their OA. So again, this points to the fact that in these patients, it might be really important for us to be able to identify some psychosocial impacts that are going on with them, because there's probably more going on because of where they're at in their life, potentially compared to someone who's a little bit older.